Okay, so I'm going to orient you all to some of the equipment for dry needling and so forth. Sorry about the quality of this video, but with what's going on these days, we're going to do this in person and we got to do it here. So just a couple things. I am a big fan of gloves while you're working on your patient. They protect you as the clinician, not the patient. It's protecting you from a needle stick, because these are pretty thick gloves. It's also protecting you from any of their blood, and at this point, with everything that's happening in the world, the gloves are an extra good idea. So I would highly recommend the use of gloves. The nitrile gloves usually is what we use. So at any rate, I have a couple different types of needles here. They're really just different brands. These are considered acupuncture needles, whereas these are considered dry needles. The difference between an acupuncture needle and a dry needle is this one is made by a company that says they make acupuncture needles, and this one's made by a company that says they make dry needles. It's really the same thing. There's not a big difference there. There's different sizes, as you can see here. These are 0.3 by 40 millimeters, 0.3 by 50, by 60, and by 75, and they go up even bigger than that. These ones over here, so I'll get a hold of it here, are 50. This is actually a 10-pack with a guide tube in it, so there's 10 needles in there, which is one of the reasons I like those, whereas these Myotech dry needles are single needles there. Okay, I'm going to try to open all this with one hand because I'm also holding the camera. But again, if you look on the needle itself, or at least the packaging, it tells you how big the needle is. It's 0.3 by 0.5. I apologize for any shaking or anything like that. Hopefully I don't give you motion sickness doing this. But, so when you open up a needle, I'm doing it with no glove because it's just me in here. We've got our guide tube, and inside, let me see if I can get it to focus on the, let's come over here. Inside that tube is our needle. Now these needles have a little glue. You can see that blue, again, sorry, doing everything one-handed. See that blue spot right there inside the tube? That is your glue for the needle. Usually it'll hold it against the wall. So when I am needling someone, this guide tube does two things. It keeps the needle clean, and it also guides the needle, hence the name guide tube. These needles here have a metal handle. You can see the handle is metal. Some are plastic. The metal you can, I prefer the metal because I can put electrical stimulation right on the handle too, as well as on the shaft of the needle. But when I'm going to needle my glove here, when I'm needling somebody, and we'll show you this better in some of the other videos, we're getting this guy lined up right where we want it, and when you give it a tap, it's a firm tap down into the, so if you look, I got the needle all the way in to the tube there, which is a big accomplishment that you want to do. When you first start taking these classes, you'll see how hard it is. As you pull up, my needle's still sticking straight up there, which means I got a good stick there. If I didn't get a good stick, then a lot of times you'll pull that tube off and you'll see the needle will fall off to the side. I just needled my table, I think, through this. That's all right. So that is sort of your orientation to the needle. As you can see, the needles are thin. They're wispy little things. So the longer the needle, the harder it is to advance the needle. Whereas the shorter ones are not too bad. Like you can get these through skin and through fascia pretty easily. This is a 50. You get up to those 75, those bigger ones, the 60s even, are kind of tough. And then we have some really big ones here. This one, how long is this one? I think this is a 135. It's hard to tell on here. The writing's pretty, but this is like for a glute or something like that. Whereas these other ones, the 50s are for, you probably use these the most. 50s, maybe 60s the most. Okay, there's your quick orientation. Some no-nos that I did, you don't put the tube down until you've got the needle where you want it. I can show you in some of the other videos when I have two hands how to reshaft or re-tube the needle. All right, step one.